So that's where biologics really started. These people who had chronic overuse injuries of tendons or soft tissue areas, surgery is not a great option. Surgeons will go in and debride them to try to get blood flow to them, but that only brings about your body's baseline ability to heal something. So normal healthy tendon is dense collagen. It's linear, ropey, elastic. And if you cut it open and you look at it, it's all glistening and white and thick. In fact, if I put a needle in a healthy tendon, I can barely inject any fluid. It's so dense and the collagen has so much substance. Well, there's a spectrum. So an acute inflammation, so let's say I'm out pulling weeds and my elbow hurts for a day or two after, or I'm pitching a baseball game in an inning. In a game, I'm pitching an inning and my elbow's a little sore. I ice it, I rest it, I might take some ibuprofen. That's acute inflammation. But what happens is if the tissue just doesn't heal, it sets up this chronic inflammatory condition. And when I went to med school, inflammation was just inflammation. Yeah. We didn't distinguish between acute, which I like to call red hot on fire, and chronic and smoldering. So think about two different fires. Red hot on fire is way different than chronic smoldering. So the things that help a red hot on fire tendon, rest, ice, bracing, NSAIDs, aren't going to help a chronic inflammatory condition. So a chronic inflammatory tendon, like you're talking about, it actually changes from linear, ropey, elastic collagen to this gray, we like to call it booger tendon. I know it sounds terrible, but that's what it's like. It's this mucinous, sticky tendon that really not only has lost its normal texture and its normal collagen fiber, but then it's lost its normal elasticity and its ability to both concentrically load and isometrically load, and it causes pain. Yeah. So and that's crazy because if you look at a normal tendon versus an abnormal tendon, a normal tendon versus a tendinotic tendon, huge difference. So that's where biologics really started. These people who had chronic overuse injuries of tendons or soft tissue areas that really surgery is not a great option. Surgeons will go in and debride them to try to get blood flow to them, but that only brings about your body's baseline ability to heal something, okay? So if something's not healed, you have to ramp it up and almost give a hyper-healing response. So we found that if you concentrated platelets down into what we call platelet-rich plasma, inject them into the area of injury, you could then promote a hyper-inflammatory, a hyper-healing response that would then get normal tissue to regenerate.